Recording. Awesome. So now we're recording. Welcome, everybody. This is a webinar, and it's the first of a three-part series that we're going to be doing on coding and billing for orthopedic braces. And one of the things that has been very, very common over the last year or so, as we've moved through the whole COVID pandemic and practices really looking for ways to subsidize revenue, is that one of the hottest topics of medical revenue has been for individual practices has been offering orthopedic braces or durable medical equipment to their patients. Now, durable medical equipment is a big topic, right? So there are all kinds of durable medical equipment out there. You have glucose monitors and wheelchairs and canes and crutches and braces and enteral and parenteral nutrients and things like that. So when we talk about DME in this particular presentation, if I use the word DME, I'm going to be referring to braces because we're going to be landing on one particular type of DME supply, which are orthopedic braces. My name is Lisa Majeski, and I am the owner and president of Gold Star Medical Business Services. We have a co-sponsor with us for this particular webinar, and that is Matt Snyder of JMS Med Supply. I'm going to introduce myself, and then I'll let Matt come off of mute and introduce himself and tell you a little bit about his company. For those of you who don't know or have not ever heard of Gold Star, we are a medical billing company. We do outsource medical billing. We also do billing for DME. We represent most medical disciplines, and we represent the professional side of medical billing. Our company does not do any institutional billing like hospital or skilled nursing, home health, that type of thing. But we do any type of billing for providers we can handle. And of course, if you do not know about Gold Star's products and Gold Star and what we have to offer, I would recommend that you give us a call. We have our contact number on the screen that you're seeing right now. I've also, for those of you who received an invite, I did send you the handouts with the PowerPoint presentation at the last invite that you received. So if you want to, you can follow along with the handouts and make notes on the handouts if you'd like to. And I'd also like to welcome our co-sponsor, Matt Snyder of JMS Med Supply. Matt, are you off mute?
I am now. Can everyone hear me?
Yay, there you are. Yes.
Perfect. And I apologize, my video is not working, but as long as the sound works, we can go from there.
That's absolutely correct. So Matt, why don't you tell everybody a little bit about your company, what you do, where you're located, and who you serve, whether you're a nationally servicing company and all of that. So I'm going to let you tell us a little bit about yourself.
Absolutely. We are JMS Med Supply. We are a wholesale DME supplier. So we sell directly to medical offices, mainly private practices across the country. We are not regional, so we can sell to anybody across the country. We've been open for almost 10 years now. So we have a pretty good knowledge of the DME industry, the different braces, the quality of bracing. One of the things that kind of sets us apart is we have been a Medicare DME supplier in the past. So we've gone through the hoops of getting our PTAN number, supplying patients with bracing, LMN, letter of medical necessity, prescriptions. So we have a pretty good knowledge of that. We are now strictly a wholesaler, but we do have the knowledge to help some of the providers with different documentation as far as billing and dispensing bracing. We are also an accredited facility with the Board of Certification. We don't need that anymore, but we like to go through the process every 3 years. We feel that it adds a little bit of credibility to our company. And we are based out of Tampa, Florida. So that's pretty much it.
Thank you, Matt. I appreciate that. And we'll have Matt back on as we discuss some of the different types of braces that can be billed for. And Matt will explain what they are and what the differences are between some of the different braces that you'll be seeing, what you'll be learning about today. So let me get my little PowerPoint moving. Okay, so this is part of a three-part series. Today is part one, and this is going to focus mainly on coding, billing, and documentation of orthopedic braces. And so our learning objectives today are going to be, first of all, to understand about the different types of orthopedic braces, the codes for those braces and what codes can and should be billed, modifiers that should be used, and then of course the importance of putting in the correct place of service code for durable medical equipment and for braces. And then finally, we'll be discussing fee schedules and documentation requirements. Now for part two and part three, for those of you, if you're listening in today and after you've listened to this webinar and you've never done bracing, or maybe you have been billing for bracing in the past and now you're not for whatever reason, and you're really interested now in revisiting on how to become a DME supplier with Medicare, how to get credentialed by the insurance companies. We'll be talking about that next Tuesday, same time. These will be every Tuesday at noon Eastern time. And so our second part is going to be all about credentialing and about how to become a DME supplier, what specific state licensing requirements you may have, and how to find out what those licensing requirements are, depending on the type of bracing that you're going to be offering. And we're also going to be talking about the competitive bidding process that is right now that Medicare has instituted for certain types of orthopedic braces, namely the off-the-shelf orthopedic back and knee braces. We'll be talking a little bit about competitive bidding today because it's really kind of impossible not to talk about it when we talk about billing for orthopedic braces. But we'll be getting into much more detail about the whole competitive bidding issue. And then we're going to finish and segue that with how to basically get around that competitive bidding problem that we have with Medicare at this point in time. If you are one of those types of practices that you're feeling a little bit dead in the water because of the competitive bidding, we're going to talk about how to become a certified orthotist and be able to offer through Medicare and through the BOC accreditation, how to offer those prefabricated and custom fitted braces without having to go through a 4-year program. And we're going to have a guest speaker who is going to be talking quite a bit about that and about the program that she has to provide an online school for becoming a certified orthotist and getting the exemption from Medicare to be able to do this and continue to offer those prefabricated braces. So without getting too much into it, we'll talk a little bit about that right now. So basically, when we're dealing with braces, we're dealing with 3 types and these is really according to Medicare's definition of the different types of braces. So when you're looking at the Medicare payer guidelines, which most of the commercial payers follow the Medicare guidelines for the braces, is you've got 3 types of orthoses. You have what are called the off-the-shelf orthoses, and these are pre-made. They're small, medium, large, extra large. There's no customization involved in the off-the-shelf orthoses. Then you have what are called the prefabricated orthoses that can be custom fitted, and then you have the custom fabricated orthoses. Now, most of us who are listening in probably will never ever deal with custom fabricated orthoses unless you're listening in and you do actual prosthesis, or you have a lab in your facility in which you can actually mold and make the orthoses, you'll probably be dealing with either the off-the-shelf or the prefab custom-fitted orthoses. These are the types of orthoses that are the most commonly prescribed by physicians' offices and by medical clinics. Now, Medicare, as I was saying a little bit earlier, they currently have off-the-shelf back and knee braces under a process called competitive bidding. Now, I'm going to talk a lot about what competitive bidding is and what it means in next week when we have a more rigorous discussion about that. But essentially, what's happened with the competitive bidding process, which began January 1st of 2021 and is scheduled to be a 3-year program where competitive bidding is going to be required for the next 3 years, is that any provider who is classified or supplier who is classified as a medical supply company, and that would include, for those of you who are doctors of chiropractic and you own your medical corporation for at 100% and you do not have a physician who's at least 5% direct or indirect owner of your medical corporation, you are affected. Also, those of you who are private citizens who have enrolled in Medicare as a medical supply company, you are also affected by competitive bidding. So really, the competitive bidding rule and regulation now has kind of taken the wind out of your sails for offering just the plain off-the-shelf orthoses. However, there may be a way for you to offer the prefabricated custom-fitted orthoses as a Medicare supplier, but there are some requirements that need to be met that we will then talk about in our third presentation on July 6th. Now, medical supply companies can offer the prefab custom fitted, but you may have additional certification and state licensure. So those are the types of braces that we're going to be dealing with today, are going to be the off-the-shelf and the prefab custom fitted. Now, for those of you who are listening in, when we talk about the competitive bidding process, please remember that that is a process that is indigenous to Medicare and not to your commercial payers. So if you do DME billing or bracing for commercial payers, you can still offer the off-the-shelf orthoses. Now, what we're seeing though with those off-the-shelf braces, because of competitive bidding, is that the reimbursements on the commercial side have gone way down, almost to the point where they're not covering the cost of the brace. And so what you have to do is you have to let the insurance company know what your invoice cost is for those braces in order to be able to cover your costs and so on and so forth. We'll talk a little bit about that when we talk more about the actual billing for those braces to the commercial payers. So I'm going to turn this over to Matt now, and the next 2 slides basically deal with the most common lumbar and knee orthoses, and we're just going to really plant ourselves. Now, obviously, there are elbow, orthoses, there are wrist orthoses and AFOs, ankle foot orthoses that we could be talking about, but we don't have enough time. So what we're really going to be honing in on are going to be the orthoses that are most commonly prescribed in medical clinics for patients because of the types of diagnosis: low back pain, osteoarthritis of the knees, knee pain, gait disturbance, gait problems are your most common musculoskeletal problems that are seen across the board throughout medicine, whether it is chiropractic, physical therapy, pain management. These are very common diagnoses. And so this is where these types of orthoses may help you with providing some type of relief and treatment for your patients. So Matt, I'm going to let you talk about the LSOs first. When you're finished, let me know, and then I will move the slide to the next one on the knee orthoses. So Matt, go ahead and take it away.
Of course. So with these codes, with the competitive bid, the off-the-shelf bracing, a lot of the manufacturers, what they did was when they get a brace classified as, for example, the top brace, the L0631, that's going to be a brace with, I call it a turtle shell. That's the easiest comparison for the brace. So with the L0631, the manufacturers, they also sent coding to PDAC, which is the organization that classifies these braces and gives them an actual billing code. They actually went out and got a dual code for these braces. So for example, the L0631 also with one of the manufacturers that I use, which is Aspen Medical Products out of Irvine, California, they got it approved as an L0648, which isn't listed here, but I can kind of use the 50 as an example. The L0631 / L0648, these manufacturers of the braces went out and got them dual coded. Therefore, when they ran into the competitive bid issue, they wouldn't have to send their brace out to get it recoded with competitive bid or to have an off-the-shelf code. Same thing with the L0637. These braces that we sell they do come sized, but the main braces that we offer are adjustable. And if with the language at the end of the L0637, where it says, or otherwise, it's bolded at the end of the 37, or otherwise customized to fit a specific patient by an individual with expertise. So these braces come out of the bag and they're adjustable. So they have adjustable flaps on the side that adjust to a particular patient's waist size. So it therefore fits the otherwise custom to fit a specific patient. So the manufacturers were very smart with what they did by going out and getting a dual code for the off-the-shelf and also the custom prefabricated. So Lisa, I know you didn't put the 4.8 there, but the 3.7 and the 5.0 that's a good comparison as they're called crosswalk codes.
Okay, great.
So that's it for the main LSOs that are being used in the clinics.
Okay. So what about the offloading knee braces?
So with these braces, you have the L1832, which is going to be a dual range of motion knee brace that has hinges on each side. You can lock that brace, as the hinges actually have little pins that fit in, and you can actually lock that brace into place. That's what gives it the code L1832. Now, this brace also has a crosswalk code for off the shelf. That is L1833 versus L1832. Once again, the manufacturers of these braces, they went out and they got these braces dual coded to fit both off the shelf and fit custom prefabricated. So these braces they come universal sized or sized once again, but the universal braces do take some minimal adjustment to each patient's knee. So the same thing applies to the L1843, which is a single upright OA knee brace. That one has a crosswalk code of L1851. So L1851 is going to be the off-the-shelf code for that brace. I see it down here. I'm sorry, Lisa.
Yeah, that's fine.
And then, so like I say, I keep repeating, these manufacturers were very smart by going and sending these braces off to PDAC and getting them dual coded, because they fit a tremendous amount of patients, and it's great for the doctor on the billing side as well.
So, and also just an FYI on the 1843 code, that's the one that you're going to use with the patients who have the diagnosis of osteoarthritis. So this particular brace, one of the billing errors that I've seen, fairly commonly, is that the providers will bill for this brace but not use osteoarthritis as the primary diagnosis for the brace, which is going to get it denied. So make sure you are purchasing the correct brace for the correct diagnosis. It's really important to note that, because I think sometimes you kind of get fixated on a brace, and you have to understand that these braces have different applications and different reasons for purchase. And so make sure when you contact Matt or, for what brace would be best, that you let them know what the diagnosis is so they can guide you to the correct brace. Okay.
Correct. And Lisa, I wanted to kind of add on to what you're saying there. With the L1843, typically our providers, that is going to be more of a short-term knee brace. It's an unloader. So it's meant for, like you said, osteoarthritis. It's not really made for long-term use, but the L1832/1833 is more of a brace that someone that has a chronic knee issue, they can use that brace while they're walking, while they're playing tennis, while they're a little bit more active. Whereas the 1843 is, it's one of those larger knee braces with the single upright hinge. That's not really made for someone who's going to be more active. So I was just kind of expanding on your
Yeah.
description of how to back in a brace to the proper diagnosis. So along the lines of different bracing products, there's thousands of different braces out there.
Yeah.
We've seen every one of them under the sun. There are ones that are superior to others. And that's what I always try to stress to a lot of the providers is you want to buy a product that is going to be reflective of your practice, your clinic, and you as a physician. So some of the braces, they're out there, they're very cheap and they're very cheaply made. And, 3 months later, the patient comes back and they have to return it. Its straps are broken, things like that. So that's also something that we try to, we try to carry the highest quality products in the market.
Yeah, and that's such a great point, Matt. And actually, it's one of my next slides kind of talks to that point. I think sometimes also, and I've had this situation where clients of ours who've been doing DME billing will reach out to their account manager, their biller, and they'll say, the patient has brought the brace back because it doesn't fit or it's not working for them or whatever. And can we send it back, or can we, what can we do with this? Because here's the problem. The problem is once you billed for a brace, like with Medicare, you're not going to be able to bill for that brace again unless you can show that the brace is damaged beyond repair. And there are quite a few hoops to jump through when it comes to rebilling a brace. So it's not like you can, bill for a brace and, oh, well, that brace doesn't working. And so now we're going to get another one and we're going to bill for it. Well, the second one gets denied because you didn't take the right steps to back out of that purchase, let the insurance company know that brace didn't work, and now we have some problems. So really, you really need to lean on your supplier for guidance as to what would be the best brace depending on the patient's condition, and not just, it's not a one size fits all scenario, because these braces are so customized to those individual conditions and those individual scenarios that may be going on with the patient. So beside the braces, there are other codes that can be billed in conjunction with your brace, with the delivery of the brace. And those are, first of all, your evaluation. So obviously, in order to supply a brace to your patients, you have to establish medical necessity. And you would do that through your traditional evaluation and management codes, if it's a new patient, in 99202 or 99203, depending on whether you are just doing an evaluation for the brace and you're focusing that evaluation, or you are doing a more comprehensive evaluation for pain management. You would need to choose the correct E&M code and then establish medical necessity for that brace within that evaluation. And for an established patient, it would be a 9921 to 99213, et cetera. Same situation. Now, if you're listening to this and you're a physical therapist or an occupational therapist, your evaluation codes are slightly different. For a PT or an OT eval, it would be something like a 97161, which would be a fairly straightforward, or a little bit more comprehensive would be a 97162. For OT, 97165-166. And then on the back side of the delivery of that brace, you could bill for orthotic management and training. That includes assessment and fitting, especially if you are doing a prefab and then you're custom fitting that brace. The 97760 code is an applicable code, and it can be used for periodic follow-up. So like a 3-month follow-up. This is a timed code in 15-minute increments. And then there's a simple gait training code. So for example, if you are, if you're going to be working with a patient and let's say you're giving them an offloading knee brace or, a knee orthosis, and they have a lot of stairs and you want to do training with them on how to get up the stairs, while they're wearing that brace, you could do gait training with those patients. And so there are additional codes that can be billed out. Now, one of the tricks for Medicare, especially billing out, is that you're going to bill these codes to your Medicare administrative contractor for Part B, and for DME, you're going to bill it to your DMERC or your DME regional contractor. So you can't bill them all together. Now, with commercial, you can, because the commercial payers don't have a separate contractor for billing out the DME supplies. But these are some other codes that can be billed out in conjunction with your orthotics. Now, your braces can be billed to commercial payers. They can be billed out to Medicare, Medicaid. Now, Medicare does require a enrollment to become a DME supplier. And we'll be talking about that in part 2 of our presentation next week. Medicaid may also require supplier enrollment. Certain states do require that if you're going to be a Medicaid supplier, that you have a specific supplier enrollment, or you may have to be certified in the state in which you dispense the supplies in order to be able to bill Medicaid for that state. Braces can be billed under personal injury claims and work comp claims as well. So really, bracing can be billed out to almost any type of medical scenario that a patient may be having. And one of the things that I think it's really important to, and this is something that I find that providers have a really hard time wrapping their head around, because of even the way they talk about braces, is that when you are prescribing braces, you are becoming a supplier, okay? You're becoming a supplier. And so what you're doing is you're not doing a medical procedure anymore. You are ordering a supply for that patient for use in that patient's home for the most part. And so not only do you need to be able to evaluate the patient for medical necessity, but then once you do that and you put bracing into the mix of the type of treatments that you offer, you have to put that bracing into a whole separate category of a supply. And in order to bill for a supply, you have to write an order or a prescription for that supply, and you have to dispense that supply before you can bill for it. Okay, and so you can't, at the time, so one of the big mistakes that I see made, that can cause a lot of problems with audits are providers who will evaluate the patient and then order the brace and bill for it at the time they order it, but they haven't delivered it to the patient. Big no. You can't do that. You cannot bill for the brace until the patient has taken delivery of that brace. So it's real important to know the workflow process, and I'll have a little screenshot for you of how that workflow should be handled within your practices. Now, if you're a chiropractor, obviously if you're an MD, a DO, nurse practitioner, a physician assistant, PT, OT, or a doctor of podiatry, you could bill your braces to commercial, PI, work comp, Medicare, and Medicaid. Now, again, you would require a specific supplier enrollment as a physician supplier through Medicare, Medicaid. You may need some additional state licensing. As a chiropractor, you would need to enroll as a medical supply company with Medicare, and we are going to talk about that in part 2, and that would involve maybe some accreditation and some other things that you would need to do. Now, it's a little bit more costly, but when you look at the, and I'll show you some of the allowables that you can get on your braces for Medicare, the cost and the investment into becoming a medical supply company, and my feeling is it's kind of a no-brainer. You may disagree with me because there are, very specific requirements that you would need to meet, but we'll talk about that next week. Now, what you would always want to do is make sure that before you dispense a brace to a patient is check with your payer for the rules and guidelines on who can write the order for that DME or that supply to your office. Now, these are some of the, I just pulled the Medicare fee schedule. The most recent one is April of 2021. These come out on a quarterly basis, so July will be the next update of the fee schedule. And it usually, if it varies at all, it's going to vary just by a few cents to a few dollars. But this gives you a good idea of what you would expect your Medicare allowables to be. Now, if you want a copy of this full fee schedule for Medicare, let me know. Just send me an email and say, hey, send me the link to obtain this fee schedule, because this fee schedule is indigenous by state. So you'll notice when we look at the fee schedule, there is a ceiling and a floor, which is an absolute maximum that's paid and a minimum that's paid out on that fee schedule. But there are also specific state reimbursements. And you'll notice that most of the states, you'll see, for example, in column H, that represents Alabama non-rural. Some of these states will have some of these codes will have non-rural and rural fee schedules. So if you're operating in a rural area versus a non-rural area, you may have a different fee schedule. If they don't have a fee next to the rural, then you would just take the non-rural fee as the allowable. Okay. And so, and again, under the LSO, this one is the lumbar sacral orthosis, the L0650. You'll notice that there is no floor and no ceiling because of competitive bidding. And so if you're under competitive bidding and you're not exempt from that, then you would have to go through competitive bidding. But if you're a physician supplier, you can offer and you're exempt, then you become exempt from competitive bidding. And then this would be your average fee schedule, depending on the state that you're in. Obviously, this is a big document. It's a big spreadsheet. And we can't represent all the states on the spreadsheet. It would be too small to read. The next one gives us the average, a range of fee schedule for your knee orthoses, so your offloading and your knee braces, and you can see that your reimbursements for these supplies are quite significant. So Matt, I'm gonna let you. I'm gonna come back to the LSO. So what would be the provider's wholesale cost for the LSO, so they can see what that profit margin might look like?
Yeah, absolutely. So with the L0631, those braces, we have two main manufacturers that we use. One is going to be Aspen Medical Products, and the other one is Trend Medical. So you'd be looking at a cost for the L0631 of somewhere around $95 for that brace. When it gets to the L0637, they go up about $10. So you're at about 105, 110, depending on which brand you're buying. And then the 50 is dual coated as the 37, so it's the same brace. So the L0631 and the L0648 are going to be the same brace, same cost. There's no price difference in the between the off-the-shelf coated brace and the custom prefabricated, because They're both the same brace. So the
And what about
margins
the knee
are
braces?
clearly, I'm sorry?
Yeah, I mean, if that doesn't excite you, I don't know what does. I don't know of any medical procedure in which you're going to see that kind of a profit margin. I don't know of any that gives you literally that significant of a profit margin. You're looking at almost 1,000% profit margin on these, on these brace deliveries. And so what about the knee braces?
So as far as the L1832, which is also crosswalk code, it's dual coded as the L1833, which is right below that. But that's going to, like you said, that's competitive bid. Those braces, they come either sized or universal. Some of the doctors, some of the providers like the universal idea because they don't have to stock sizes. But in my opinion, the size knee braces are a little bit better of a fit because anything universal is going to have a little bit of a wiggle room with fit. But those braces cost anywhere between $50 to $60. That's the physician wholesale cost. And then once you get into the L1843 and the 1851, those are a little bit more expensive, but as you see, the reimbursement goes up. Those braces run anywhere, depending on the brand, anywhere from $100 to $125 wholesale physician cost.
Now, some of you have told me in the past that when you bill out to your commercial payers, you're only getting paid, based on the wholesale cost. And if it, and some of you have said, on the commercial side of things that, you're barely covering your costs. And so one of the things that you definitely want to do, and I'll show you a little bit of a snapshot of how to do this, is try to obtain ahead of time your fee schedule on the commercial payer side. Now, I do know that most of the commercial payers will follow closely the Medicare fee schedule. So it could be that, one of the things that you may need to do on the commercial payer side is when you're billing out those braces would be to hard code the invoice amount into the or the wholesale acquisition cost of that brace into the claim itself. And we can talk about that here in just a bit. So to access your fee schedule on the commercial side, you may need to request it, but what you would want to do is you would want to essentially go to the payer site for that commercial payer, whether it's Blue Cross, Aetna, Cigna, United Healthcare. Go to the provider side of the website, and then just type in under a search. There's usually a general search bar somewhere on that site, and you can just type in fee schedule or DME fee schedule even, and those keywords will bring up instructions on how to access your fee schedule or where to call to get that fee schedule. So knowing in advance is you kind of half the battle. You want to make sure you know what that fee schedule is going to be for the type of insurance that you're going to be billing out for. Because again, it's not just about billing this to Medicare, it's also your commercial payers as well. So to order the braces and supplies, you're going to want to use a reputable company. Like Matt said, you don't want to just order from, some overseas wholesaler because you can get it cheaper. I can't even imagine, that when Matt gives us the prices, the wholesale prices that he has, and he's using a supplier like Aspen, which brings, has some of the highest quality braces out there. I would imagine that Matt's profit margins are not that much. And so, I honestly believe that, you want to order it from a reputable company, and you want that supplier to give you all the support you need to successfully deliver, fit, and get paid for your bracing, which would include possibly templates for your documentation if they have them, guidance on what conditions the braces are indicated for, and the guidance you need to properly fit that patient. And I, after vetting JMS, I know that they check all of these boxes. So I feel very confident in recommending JMS as a wholesale supplier for my Gold Star clients. And, and I hope that, all of you who are listening in today will, and if you're going to listen in after this is recorded, that you at least contact Matt for more information about the supplies that he offers. Okay, so we're going to get into, we talked about the HCPCS codes for the braces. And one of the reasons why a lot of providers, when they first start billing out DME, don't get paid is because they don't code it right. They don't use the right HCPCS codes. They don't use the right modifiers. And so you have to understand how to properly apply the modifiers that you need in order to correctly bill out. Now, these are some common modifiers. There are others that may be applicable depending on the payer guideline. I'm not going to go through all of them in this, we only have an hour today, so I'm not going to go through all of them, but KX is used almost with every brace that you would supply for Medicare anyway. Now, most of the commercial payers also require that KX modifier. And the KX modifier is basically an informational modifier that lets the payer know that you have met the requirements for establishing medical necessity and that you have followed the medical policy, that the requirements specified in the medical policy have been met, which requirements are your medical necessity and your documentation requirements. For your knee braces, because knees come in on right side and left side, you're going to have to indicate to the insurance company if you're dispensing a knee brace for the right knee or for the left knee. And if you feel that this knee brace or the back brace may not get paid because one had been dispensed within the last 5 years, and you wanted to let the Medicare patient know that you that there's a chance that brace may not get paid and they might become financially responsible for the cost of that brace, is you would do an ABN form, and then the GA modifier lets Medicare know that you have an ABN on file for that particular supply. The RA is a replacement of a DME item due to loss, irreparable damage, or when the item has been stolen. And you most likely will need to provide documentation and some type of a form that the patient signs to attest to the fact that that their DME supply was lost, irreparably damaged, or stolen. Now, there are two modifiers for the competitive bidding issue. So if you are a physician supplier and you are exempt from competitive bidding, then you could bill for the off-the-shelf orthoses and use a KV modifier to let Medicare know that you are exempt from competitive bidding. And if you're a PT or an OT, you would use the J5 modifier for the same situation. So if you're a PT OT supplier and you ordered the brace, then you would use that J5 modifier because of the competitive bidding exemption for your type of supplier classification. Now, if you're a 100% DC owned organization, or if you're a private citizen and you're offering an off-the-shelf orthosis, then the KV and the J5 modifiers will not apply to you. So if you have any question about whether you would be exempt from competitive bidding or not, you can certainly contact your account manager. You can contact me, and we'll be happy to assess that with you. And then we'll be discussing this kind of ad nauseum next week. So if you want to just wait a week, you'll probably get all of your questions answered about that next week as we discuss the credentialing and competitive bidding process. So what's the workflow for a, if you're going to be a DME supplier, and remember, you have to take off your provider hat when you're offering DME to a patient, and you have to put on your supplier hat, right? And in some cases, you do both. You're going to be a provider in which you're going to evaluate the patient for medical necessity. You're going to confirm whether the patient has had a brace in the recent past in the last 5 years. You may have them sign an ABN form. And then what you're going to want to do is you're going to want to verify benefits. Now you can verify if you're Medicare, if you're a Medicare supplier, there is a way to verify whether the patient has had the same or similar DME in the last 5 years if you have access to your DMERC portal. And again, you can talk to your account manager about how to go about that, or you can reach out to me and I can send you a link to register for your DMERC portal so that when you're offering that DME supply, you can verify whether that patient has had same or similar DME in the last 5 years. If it's commercial, you're going to want to verify benefits and find out if prior authorization is needed for that supply. Then at that point, you're going to want to write or obtain the order for the brace and order the brace from Matt, then deliver the brace. And once you've delivered the brace to the patient and properly fitted it and given them their instruction, then you would go ahead and bill for that brace. Now, prior to the delivery of the brace, you can bill for the evaluation, for the consult, the 99, or the PT eval or the OT eval. You can bill for that ahead of time. And actually that helps establish medical necessity and helps avoid audit because you've already billed for the evaluation for the brace. So you definitely want to do that first. And then once the brace is delivered, now some of you may end up ordering braces and keeping them on hand, especially if you're ordering different sizes, you may keep inventory. And it could be that you will evaluate, write the order and deliver the brace all on the same visit. You can do that, but you're going to have all the documentation in order in the patient's medical record in order for us or your in-house billing department to bill for that brace. So when you're, if you're needing to replace a brace or a DME supply, you need to check with your commercial payer for the guidelines on whether, on how often that brace can be replaced, because they may not go by Medicare guidelines. They might, but then they might not. So you can't assume that the Medicare guidelines are going to be the same guidelines for your commercial payers. So for Medicare now, if the equipment is worn out, and this is quoted directly from the Medicare rules, if the equipment is worn out or lost, irreparably damaged, Medicare will only replace it if the patient has had the item in their possession for its whole lifetime. And an item's lifetime depends on the type of equipment, but in the context of a replacement, it is never less than 5 years from the date that they began using the equipment. Okay, so you always want to ask that patient, if it's Medicare, have you had a brace in the last 5 years? If the answer is yes, have you had it in your possession the entire time? And is it irreparably damaged or was it lost? And if it was lost, what is the scenario under which it's lost? And you need to document that, okay? So always ask the patient if they have received a brace in the past 5 years. So how do you find out if a brace or supply needs prior auth, what the documentation requirements are, what the criteria is for medical necessity of that brace, if the payer is even going to cover the brace or supply if it's ordered by a certain type of provider, such as a chiropractor, or if the brace can be ordered by the DC, or does it have to be ordered by an MD or a DO or a PT or a podiatrist? How do you find all of that out? And honestly, if you don't do your due diligence at the front end of all of this, you're going to find yourself spending money on these braces, billing them out, not getting paid, and then getting discouraged about the whole bracing program for your practice. And I don't want to see that happen. So what you have to do is you have to commit to doing that due diligence on the front end. And so what you want to do is do your homework. Go to your payer site, pull all the guidelines and policies you can find on the bracing on each payer site for the main insurance companies that you deal with, and that includes Medicare. And then you're going to verify benefits on a patient by patient basis. So you want to make sure, even for Medicare, even though you know what the fee schedule is and you know the Medicare billing rules, what are you going to verify on a Medicare patient? Same or similar DME. Has a same or similar DME been prescribed to that patient in the last 5 years? So you want to definitely verify that through your Medicare portal. So pull your guidelines, go to the payer sites, begin to develop a database of payer rules and regulations for the dispensing of your supplies, okay? And when you're verifying benefits to the commercial payer, don't just ask if DME is covered or if that HCPCS code is covered. You want to be very specific in your questioning of that for that DME supply and for that code. So you want to ask this question: is there a different deductible or coinsurance for DME and supplies? Does this supply or does this HCPCS code require prior authorization? And if so, how do I submit for prior authorization? Is there a form I need to fill out? Do I need to do this online through a portal? Do I need to fax the prior auth? How do I do this? Because you want to be as efficient as possible with your prior authorization, because remember, prior authorization could take 3 to 7 to 10 business days to get back from the payer, and you don't want to delay dispensing that supply. Do not dispense a supply if it requires prior authorization until you've received approval. Okay, you can't do this after the fact. You've got to make sure that if it requires prior authorization, you obtain that prior authorization with enough time to to get it and then dispense it. Okay, if you're a DC, you need to ask, is this supply covered when ordered by a doctor of chiropractic? Okay, and are there diagnosis limitations? So many times when you verify benefits for DME, they're going to tell you it's diagnosis driven. So if you ask them, well, what diagnosis, they're going to tell you, well, we can't tell you that, you have to look up the guideline. And that's where you would go and you would want to pull in the medical policy for that type of brace from the different payer sites. So this is an example of Aetna. Aetna, and the nice thing about the Aetna guidelines is this is definitely national. So it's not like Blue Cross Blue Shield. You're going to have to go to your specific state site. Like if you're in Virginia, it's Anthem. If you're in Alaska, you'd have to go to the Primera site, and so on and so forth. But Aetna is Aetna everywhere. So for DME. And so that's why I use Aetna as an example. So what you would do is you would go to your Aetna site for healthcare professionals. You would go to resources, and these are just some screenshots that kind of show you the progression of how to go about getting and pulling those payer guidelines. You can search for the guidelines by CPT code and the CPT code. If you type that in, it will give you any prior auth requirements, clinical policy bulletins for medical necessity and documentation criteria. And then, and so like, for example, if you want to find, whether a certain code needs prior auth, you type that code in, okay? And then it lets you know whether prior auth is required or not. And this one basically states that for the off-the-shelf LSO, if you're a participating provider, no prior auth is required when it's performed as an outpatient procedure or for a medical or surgical diagnosis. Okay, if you're non-par, then it may require prior auth. So you also need to know whether you're participating or not participating with that plan to determine whether prior auth is necessary. So to document now medical necessity for that DME or supply, you need to know what is required of the payer for that. So the Medicare documentation, my recommendation is for whatever supply you're going to be dispensing, you want to pull the local coverage determination and local coverage articles, also known as LCDs and LCAs. So the LCDs and LCAs for DME supplies and for your LSOs and your knee braces are going to come from the DMERC or the DME regional contractor that you're billing out to, or from the National Supplier Clearinghouse. And so this is an example. If you are listening in and Noridian is your DMERC, your durable medical equipment regional contractor, you would go to Noridian and then you would look for the jurisdiction that the DME, so under Noridian, it's jurisdiction D or jurisdiction A. There are two regions. And I can, if you don't know, I can certainly provide that to you. So you would look for those active LCDs, and then you would pull those LCDs from the site, and it would give you a lot of information about how to correctly bill for these LSOs and for these knee braces. Now, and I put this in red and highlighted this box because this is what you need, okay, guys? So when you are dispensing DME, the general documentation requirements apply to all DME that you dispense. And this includes the SWO, which stands for the standard written order, the medical record information about establishing medical necessity, the correct coding of that supply, and proof of delivery, okay? And in some cases, certain DME may require other types of documentation, but all DME requires this. No matter what, you need a standard written order. You need to have your medical necessity, a letter of medical necessity, which is the medical record information, the correct coding, and proof of delivery. And I will tell you this, for DME, you're going to be audited. And it's not a question of if, it's a question of when. If you begin dispensing any measure of DME, there's no doubt that you're going to be audited, but you don't have to panic. A DME audit is very different than a medical procedure audit. So an audit for a surgical procedure or a medical procedure or PT. When a payer is auditing for DME, they're going to want to see that you have met the general documentation requirements and the medical necessity requirements for dispensing that DME. And as long as you have, you'll submit those records and everything will be fine. So, you know, I've had providers contact me all in a panic about getting audited on the DME, and they, they find that it's just an easy process of getting those supplies over. So these are some examples of how you would establish medical necessity based on the payer guidelines. So for Medicare, for these spinal orthoses codes, these are the indications. In other words, when you see the LCD and it says that the indications for these orthoses are for reduction of pain by restricting mobility of the trunk, facilitating healing following an injury, facilitating healing following a surgical procedure, or to otherwise support weak spinal muscles and or a deformed spine. Now you have a clue as to what diagnosis codes would justify medical necessity for that brace. Low back pain, a lumbar strain, which would be an injury to the spine or related soft tissue, facilitate healing following a surgical procedure, that could be a post-laminectomy syndrome, or otherwise support weak spinal muscles. Your DX code might be something like spinal instabilities, or a gait disturbance or something like that, okay? And so you need to make sure that you are following medical necessity. Now, I know that we are right at 1 o'clock and some of you may need to get going. I did extend this webinar for another 15 minutes so that we could get through this. I knew it was going to take more than an hour. And so hopefully you all will be able to stay on. If you can't, just remember that this is being recorded, and we'll have a copy of that recording available on the Gold Star Medical website. I'll send it to Matt, and we'll also put it on YouTube. So for your commercial payers, you can also pull the medical policy. So again, we're going to use Aetna as an example. You would go to the provider side of the Aetna portal, and you would then look for a medical clinical policy bulletin, and then type in your keyword, and you can see that you have the different orthoses, the AFO orthoses, knee, ankle, foot orthoses, lumbar traction devices, and so on and so forth. And if there is a policy for your lumbar orthoses, it will show up on the website, and then you can pull that and then make a PDF of that. So, and Aetna's policy is under orthopedic casts, braces, and splints, which is the medical policy bulletin. And again, it will give you, when you get into the policy, it will tell you what these braces are indicated for. And as long as you have a diagnosis that meets any of the following indications, it would be considered medically necessary. And so you'll notice that it seems very similar to Medicare. That it looks like almost word for word. And many, you'll find that many of the commercial payers have very similar policy to establish medical necessity for these LSOs and for these knee braces. Okay. So be aware of the medical necessity ramifications prior to ordering these braces. So number one, you order the correct brace, and number two, you know how to document for it. Now, other things that you need to know about billing out DME is that number one is that your braces are usually going to be billed out under place of service code 12. And this is a kind of a rookie mistake. When I see denials for DME, and I have a lot of doctors who contact me every week saying, oh, we're not getting paid on our DME. We don't know what the problem is. And I'll ask them to send me a copy of the claim form, you know, to just take their electronic claim and put it on a paper claim form so I can see how they billed it. And almost 90% of the time they got denied because they used the wrong place of service code. Instead of it, it's not place of service office, it's place of service home, because that's where the brace is going to be used. So make sure that when you set up your fee schedule, you set it up correctly, because most programs are going to default to 11, which is office. Okay. Make sure you apply the correct modifiers per the payer guideline. You know, if you dispense a knee brace and you don't put RT, LT on there, probably not going to get paid as not medically necessary. Make sure you have the ordering provider's name and NPI on box 17 and 17B of the CMS 1500 claim form. And make sure that you're pinpointing the correct diagnosis code for that supply in the first position of the diagnosis box 21. It should be in position A. So one of the things that I recommend is first of all, with Medicare, you have to bill the supply separately from the medical procedures. But even for commercial, I would recommend that you bill the medical procedures and you bill the supply separately so you can pinpoint that diagnosis code correctly. You don't have to, but it's usually a good process to follow. Your documentation has to clearly support the need for the brace. Make sure in your file you have a letter of medical necessity, your standard written order, your consult note, and your proof of delivery. And in some cases, the standard written order is incorporated into the consult note. So you may not necessarily need a separate standard written order as long as the order is clearly delineated within the consult note for that initial evaluation of the patient for the supply. Okay. You don't have to submit the letter of medical necessity with the claim, but in some cases, the insurance companies want you to submit the invoice and proof of delivery. Sometimes they want the invoice for the claim in box 19 of the claim form. So the individual payers may have specific guidelines as to what they want on that claim form. And also, if you're billing out to a commercial payer and the brace required prior authorization, make sure that you indicate the prior auth number on the claim form as well. Okay. Now, and don't be surprised if you bill out for a brace that the payer will pend that claim and ask for documentation. Sometimes they'll do a prepayment audit on it, and you may get a letter from, and it's not necessarily a denial, it's a request for records. And so once you submit those records that they want to see, sometimes it's the proof of delivery record, sometimes it's everything. Follow the payer's guidelines and make sure that you give them what they need in order to get that payment released to you, okay? And remember that you may not bill out that supply until the patient has taken delivery. It's a big no-no. I know you want your costs covered, but you just can't do it. You've got to have enough of a slush fund in your, in your bank to be able to cover the costs of these supplies until the payer has reimbursed you. Okay, you're not going to get reimbursed prior to delivery of that supply, or you shouldn't. So what you're seeing here on your screen is what the claim form would look like if it was set up correctly. Okay, now this is for an LSO, an off-the-shelf LSO, and remember that you're always going to want an ordering provider. The qualifier for ordering provider is DK. So make sure that your qualifier is correct. Make sure you have the name and credentials of your referring or ordering provider and their NPI number. The prior auth information usually goes in box 23 of the claim form. Sometimes they want that on box 19. And then remember to use the applicable modifiers. The organization that is providing the supply, you'll have their federal tax ID number in box 25, okay? And if for Medicare claims, you're going to fill out box 32 if the services were furnished in a hospital, clinic, laboratory, or any facility other than the patient's home or physician's office. So if you furnish let's say you furnish the brace to a patient in a skilled nursing facility, you will have to put the service facility location information and the appropriate place of service code, which then would not be the patient's home. It would be the place of service code for that facility, for the skilled nursing facility, okay? So this is just a snapshot of what a clean DME claim should look like. And of course, there are going to be variances to that as far as depending on what the payer has as far as guidelines for correct modifiers and so on and so forth. For Medicare and Railroad Medicare DME claims, make sure that you complete, and once you're enrolled as a supplier, make sure that you complete the EDI enrollment form to your DMERC through your clearinghouse, because the DMERC is like Medicare Part B. It will not accept claims submitted through your clearinghouse without an approved EDI enrollment. In final thoughts, as far as billing correctly and documenting correctly for your DME supplies, make sure you have a standard written order on file in the patient's chart. The order can be a separate script or written into the documentation of the eval for the DME. Be sure to have your letter of medical necessity on file in the patient's chart for that DME supply, and be sure to have written confirmation of delivery before billing out the claim for the DME and brace. And if you have any questions, I'm going to pull up the Q&A here and answer any questions that I can on the Q&A. But bottom line here is, if you are listening to this and you need any help with billing or credentialing or virtual training for your staff on DME, please feel free to give us a call. Reach out and we'll be happy to talk to you about what we can offer you for billing help, credentialing help, or training help. I always do a free consultation with any new prospective Gold Star client. So if you call, there's no charge to talk to me the first time, and then I'll be happy to let you know, what our services involve. And then for any questions on the DME and the supplies, you can contact Matt directly through JME Med Supply, and his phone number and his email address are listed as well. So Matt, do you have any final thoughts that you would like to, maybe something big thing I missed or I didn't cover in this session?
No, I just wanted to thank you. I put my personal cell phone on there. We're a small family-owned company, so we offer a little bit of a personal touch when our providers reach out to us. We don't. I can answer my phone at any time. As long as if I don't answer, I'm usually on the other line helping somebody else. But I like to give my personal cell phone out because if there's any issues, questions about any of the products, the sizing and fitting, I mean, we have the documentation notes for Aspen products, the letter of medical necessity, how to document a brace. So you can also visit our website. Anybody can, we have a lot of products on there. But yeah, that's it. I appreciate you, Lisa.
Awesome. Well, we do have a couple of questions that in the Q&A that you may be able to help with. Linda Holmes sent a question. Can we get a recording of the webinar? The answer is yes. I'll be sending everybody out a link for that recording of the webinar. It will be posted on the goldstarmedical.net website. And so I'll let everybody know once the webinar is converted, and we'll get that out to everybody as soon as possible. Linda also asked, are there any specific measurements we need to do for documentation when trying to get a knee brace? Matt, do you have any feedback on that?
Yeah, of course. So typically with the L1832, which is going to be the dual range of motion knee brace, has two hinges, one hinge on each side. I'm sorry. It's a little bit of a shorter brace. So that brace, typically you would measure 6 inches above the kneecap, 6 inches below. Now, obviously everybody is different with the size of their leg. So that can vary, but that's a pretty standard sizing, is 6 inches above and 6 inches below the kneecap.
Okay, thank you for that. The next question is, we're looking for an offloading knee brace for a patient who has very short legs. Is there such a thing? We haven't been able to get one, and she usually uses pediatric sized items. I think this is a question for Matt again.
No problem. So I've ran into this question quite a bit. Unfortunately, with the standard OA braces, the ones that we sell are going to be a little bit longer, and they are harder for the shorter patients. So with that being said, a lot of my providers, obviously there's a lot of variables that go into that, but a lot of our providers will put them into a dual range of motion knee brace, which is shorter. It's significantly shorter. But as far as an offloading knee brace, that may be more of a custom fitted brace. But I have run into this before, and a lot of the providers will put them into a dual range of motion knee brace, which is shorter.
Okay, great. I have another question. Do you have a video for proper bracing of the knee and lower back bracing? Matt, do you know of any, does Aspen have anything like that on their website?
I don't believe they have it on their website, but Aspen does. I want to say I can get those videos from them. I have inquired with them before. I will follow up with Aspen. I'm sure they have it. They have a pretty rigorous R&D department that before they release any of their products, they have to go through, step 1 to 5 of R&D. Mm-hmm. So I'm sure they have videos. I will definitely get those videos.
Cool. And then, if you can do that, maybe what we can do is post those videos as a like a little link on your website and the Gold Star Medical website for instructional videos. So I think that would probably be a good idea.
Absolutely.
A question for me, it says, so modifier NU is no longer needed with a question mark. A modifier NU does not apply to braces because braces can't be rented. So the only time modifier NU is required, and now your commercial payers may have a different take on this, and I have seen sometimes commercial payers requiring the NU modifier on braces, but it'll usually be written into the guideline. And the reason why NU isn't required for Medicare is because braces can't be rented. So NU is only needed when you're dealing with a DME supply that can either be rented or purchased. And so that would be when the NU modifier would be applicable, but for braces, generally not needed. And then I have a guest on the call. Minerva Mendoza is actually going to be facilitating and co-presenting with me on the third webinar on July 6th. And Minerva, I wonder if I can make you, I'm going to try to find you, make you a panelist and let you talk a little bit about your program. Okay, so I've just opened it up for you to talk, and just spend a minute or two giving us kind of a taste of what you're going to be talking about on July 6th.
Okay, can you hear me?
Can you make yourself a little bit louder?
Yes, so I think I have my volume all up. It's 100%. Is that better?
Yeah, let me see if I can't make mine a little bit. I'm gonna just escape. Okay, let me see, make sure my volume is up all the way. Okay, go.
Okay, can you hear me?
Yes, that's much better.
Okay, perfect. So in summary, well, first of all, I want to thank you and Lisa and Matt for this opportunity. Thank you, Matt, for making the connection. This has been a very informational seminar, and I look forward to July 6th. Matt has also been a sponsor for Orthopedic Fitter School of some of the products that we loan out to our participants. So in summary, what I'd like to mention is that, as Lisa mentioned, spinal and knee braces have become part of competitive bidding, right? And so the alternative is to also be able to do custom fit braces, or also to be inclusive, right, of that, to be able to do something when it comes to competitive bidding.
Yeah.
So we offer through onpedu.com an orthotic fitter course. We also do a therapeutic shoe fitter course and a mastectomy course, but we will be focusing on the details for that orthotic fitter course in July. However, if you're interested now in starting that process, please contact us or go to our website. We have an online discounted course at this time where we assign you, when you register, the part 1 of the course, where you can complete your distance learning. People take our course for a number of reasons, right? Not just because they want to have that specialized treatment as Medicare defines it, but also for liability purposes. So when you're done with part 1, we move you on to part 2. And part 2 includes the competency portion. It's where you actually fit braces on an individual and fill out SOAP notes, and we help you meet those Medicare requirements for documenting that encounter with the patient by walking with you throughout this course and instructing you on what to do. We have top-notch instructors. Anybody who's been through our course, I mean, we really try to improve the services that we offer and add a lot of value to it. So we actually provide feedback and help prepare the participants for that final exam that they have to take, whether it be with BOC, the Board of Certification and Accreditation, who is into both education and accreditation, or whether it be testing with ABC, the other national agency that certifies individuals. Yeah, so that's a summary.
Which we'll talk a lot about, but tell them a little bit about the exemption that you were able to get through your school. I think that's the part for me that's very exciting. Typically, what is required, what level of education and how much time is it normally required to be certified as an orthotist fitter?
Okay, so the DME POS quality standards in Appendix C, they define, according to Medicare, right, who has specialized training. BOC has gone over to CMS and said, hey, wait a minute, or an orthotic fitter falls under this specialized training definition according to the scope of practice. And BOC has updated that scope of practice for the orthotic fitter that includes being able to custom fit items, braces, okay? So that is the exemption that we're talking about, that or where they're inclusive, right, of who's defined as having someone who has specialized training. That we like to refer to that as the alphabet soup. And so those individuals normally include MDs, DOs, PTs, NPs, OTs, and orthotists, which is different than an orthotic fitter. An orthotist is actually, right now it's a bachelor's degree. I think they're looking to making it a master's. So an orthotic fitter is right under, it's a certification. And so an orthotic fitter now fits that definition. And so therefore orthotic fitters can custom fit braces. Okay, so once you become certified, so you test with one of the two national agencies and gain your certification, then you can go and update your 855S, your enrollment application with Medicare to be and you can update your accreditor, right? You update your accreditor and then your application to be able to select that product category of custom fit braces.
Yeah. So we'll talk a lot more about this, and we'll have it outlined in a nice PowerPoint for you, kind of like steps A, B, C, D, what we need, what you would need to do if this is a direction that you want to go, or a direction that you want to send one of your staff members to be able to do that custom fitting. And so that will be on July 6th. I want to thank you, Minerva, for just giving them a taste of what we're going to be talking about, because I think that some of our docs and some of our practice owners, even who are not MDs and not DOs or PTs or nurse practitioners, are a little discouraged about the whole competitive bidding process. But there is a way for you to continue to have your DME program by going through this additional certification. And so we'll talk a lot more about it on the 6th. I don't see any other, anything else in the Q&A or in the chat box. Let me see if there's anything. I've got some of my clients texting me on my phone with questions. Okay, nope, that's about it. And so I just want to thank all of you for your attendance today. Next week, same time, we'll be talking about credentialing and contracting to become a DME supplier. If that's something that you're interested in, we hope to have you on that session as well. And hope that all of you have a great day. I'll let you know as soon as the recording is ready. And we'll talk to you again very soon. Thanks so much and have a blessed day.